Hi again, everyone, and thank you for joining today's annual symposium. My name is Juliana Melendez, and I am a research analyst working with CNA's Project on American Justice. I'd like to go over a few of the helpful tips we have before we begin today's session. Please keep your phones or computer audio on mute to avoid background noise. This session is being recorded, so you and others may view it later on our website. We will take questions at the end of the session. If you have a question for one of the panelists, please use the chat function to direct a question to the host at any time during the session, or raise your hand during the Q&A at the end. Please edit your display name by hovering over your name, clicking More, choosing the rename option, and changing your screen name to reflect your full name and agency, so we and others may know who you are and where you're from. And as a reminder, points of view or opinions expressed herein do not necessarily represent the official position of the Department of Justice or our other clients. And please reach out through the chat function if you have any questions throughout this session or the symposium. And so now I'll pass it off to Dr. Brittany Cunningham, Assistant Director at CNA, to begin the session, Member Wellbeing, Identifying, Mitigating, and Preventing Destructive Behaviors in Law Enforcement.
Thanks, Heliana, and good afternoon, everyone, and thanks for joining us today for our panel. I'm Brittany Cunningham, Assistant Director with CNA Center for Justice Research and Innovation, and I'll moderate today's session on agency member well-being. Officer health and wellness is a topic that we are very passionate about within our center and continue to do more research to foster healthier law enforcement agency members and units to enhance readiness to operate in very unpredictable and high-stress fields. For about the next 75 minutes, we're going to introduce you to 4 different areas of work that we've embarked on the last few years to support filling gaps in research and practice to identify, mitigate, and prevent harmful behaviors with law enforcement. We're going to talk about the role of the command staff, wellness program use and suicide ideation, the relationship between early intervention systems and well-being, and review of metrics on law enforcement officer deaths by suicide. I'm joined today by my amazing colleagues that have led this work, Dr. Dan Lawrence, Dr. Tom Kristoff, and Ms. Jessica Dockstader, who I will turn it over to shortly for briefings on the aforementioned work. Following each of our panelists' briefings, we will delve into a question and answer session tying our projects back to the Project on American Justice Futures Framework. Next slide, please. I want to get us started briefing you on an area of work that has been on command staff and supervisors that we've worked on the last couple of years. Supervisors play a critical role in officer well-being, specifically pertaining to their ability to identify signs of distress, refer officers to support services, and combat the stigma towards officers seeking support. As the individual responsible for directly overseeing officers' tasks, the line officer is well-positioned to monitor an officer's changes in behavior and intervene before a serious negative outcome occurs. However, without the knowledge, skills, abilities, resources, and literacy around mental health and wellness to identify the signs of health or wellness distress, supervisors may lack the confidence to intervene when recognizing that an agency member is struggling, resulting in very unrealistic and high-stress situations and expectations for command staff. Promising practices and innovative resources and products to support supervisors in this area are limited. One method to begin removing stigma is to provide additional training and support at the supervisory level, which is what we found throughout our work is a gap in the field. Next slide, please. So what did we actually do here? And how do we get to understanding that gap? Well, in collaboration with BJA Valor, for a few years ago, we embarked on a project to better understand current efforts to promote agency member, sworn and civilian, health and wellness, explore gaps in research, and provide resources to support agencies. What did we actually do? So to do that and to meet those objectives and the goals that I just talked about, we sought input and feedback from agency patrol personnel on officer wellness related to a variety of topics. We worked with 12 agencies, and those topics included everything from anxiety, stress, sleep, fatigue, suicide ideation, and support-seeking behaviors, as well as what agencies are currently providing in the way support and resources. So we collected data through surveys of officers, interviews with officers, command staff, and training coordinators, as well as those who were leading wellness program efforts. And we also conducted a listening session with command staff as well. Next slide, please. One of our major findings in that work is that the confidence of a supervisor to intervene when an employee experiences a wellness-related issue has very important implications. Also, we found a call from line supervisors themselves for more training on how to mitigate risk for officers, and the desire from line officers to want to learn more on how to identify when an officer is struggling. So to meet that, we worked with BJA Valor, and we designed the Supporting Law Enforcement Health and Wellness workshop. It's supporting supervisors after a critical incident. It's an innovative way to provide a learning environment for supervisors to discuss challenges and identify strategies to support agency members' health and wellness, particularly following critical incidences. And to our knowledge, it's the very first workshop that's designed for agencies it's the very first workshop designed for agencies to fully implement on their own that's geared towards supervisors. So it's a workshop we can give you and an agency can implement it on its own. So I'm going to wrap up with two important points and I'm going to hand it over to my colleagues. So what are the impacts? There are two that you see here that I wanted to highlight. The first is that for agencies who engage in our workshop, it provides an opportunity to have honest, direct conversations about officer well-being in a supportive environment. The second is the workshop strengthens supervisors' ability to identify officers who may need additional support following a critical incident and provide them with the tools and skills necessary to deliver that support. I'm going to hand it over to my colleagues to start talking a little bit more about the other projects that we've worked on under our officer health and wellness area of work. I'm going to turn it first over to Dr. Daniel Lawrence, who is a senior research scientist with our center, to talk about program use and suicidal ideation. Dan?
Thanks, Brittany. Hi, everyone. So connected to the study that Brittany was just describing, one of the things that we were also interested in learning more about was each agency's staff's wellness program. So wellness programs are a relatively new program for law enforcement personnel that offer a broad spectrum of different mental health and wellness services, addressing the diverse needs of all personnel, from the sworn officers to the civilian staff, as well as spanning from new recruits to retirees. And what we were most interested in learning was how different groupings of staff utilize wellness programs. So to do this, we collected survey data from roughly 1,200 staff across 11 diverse law enforcement agencies that varied by the type of agency, the size of their agency and location, but also had varied in their length and development of different wellness programs. Next slide, please. So our study was published in the Journal of Police and Criminal Psychology, had two primary objectives. First, we sought to categorize staff based on the psychological and physical characteristics, which are displayed here in that line graph. And second, we explored the usage of agency-offered wellness programs among these different identified groups, which is detailed in the table. So results of the staff groupings were very interesting, at least they were to me. What we found was that there was a large group of staff, roughly 47%, who had really great psychological and physical health metrics. These are the staff who were doing really well. And next, there was a group of about 38 staff who make up, the in quotes standard group of staff. So people who are they're healthy, they're doing well, but not exceedingly high levels. And finally, we identified that there was 16% of staff who were the most extreme, they had the most extreme challenges to their mental and physical health. So they had seriously low levels of social, mental, physical health, self-esteem, and very high levels of anxiety, depression, alcohol consumption, among other things. And these are the individuals that an agency would most likely want to identify and get into a wellness program. They're the individuals that may most benefit from those programs. But when we then examined the use of wellness programs, we found that that this third group had very similar levels of program use compared to the other groups. The only important difference here that we noted was that the third group used counseling services, so psychological counseling services, to a significantly higher degree than the group that was most well off. So that would be as you would expect. But surprisingly, they were very similar to that second group, the group that was pretty standard in their health and wellness. So this suggests a really concerning disparity, indicating that those who would most benefit from these programs are not accessing them to the extent that they should. And this may be because of the overwhelming life circumstances that these individuals experience, which may hinder their ability to actively seek out such programs. As a result, these results really highlight the need for a targeted intervention and better support mechanisms for these staff. Next slide. And so one common metrics used to identify individuals in need of support is looking into suicidal ideation. So using the same survey data that I was just describing for a different study that's currently under review for publication, we examined suicidal ideation among 883 personnel. We first aimed to examine how different characteristics of agency members affect the degree of suicidal ideation, which was measured as a severity scale. So where staff either did not have any ideation, had contemplated suicide, or had made a plan or had past attempts of suicide. And I'll note that the majority of the sample, 75% of the sample, had no suicidal ideation. 19% had contemplated it before, and only 3% had made a plan, and an additional 3% had actually had a past attempt. And not surprisingly, the results indicated that the psychological metrics that were the leading factors contributing to suicidal ideation. So most notably, self-perceived their mental health and also having PTSD. But agency size was also an important factor in our analysis, where staff from larger agencies have higher suicidal ideation compared to medium and small-sized agencies. And we think this might be because staff in smaller agencies are better able to have more meaningful connections with other staff and other sources of social support, relative to larger agencies where those connections can be more difficult to make. But the findings on mental health and PTSD were by far the strongest predictors of suicidal ideation. So to examine this issue in more detail, we conducted what's called a mediational regression analysis, where we found that having PTSD leads to lower mental health, which in turn results in more severe suicidal ideation. So that said, another way to think about it is that this also indicates that a person can have PTSD, but if they have a strong support system to improve their mental health, they will be less likely to have suicidal thoughts. And so on that note, I'll conclude and I'll pass off to my colleague, Jessica Dockstader, who will talk more about our work on deaths by suicide. Thank you.
Thanks so much, Dan, and good morning or good afternoon to everyone based on your location. My name is Jessica Dockstader, and I'm a research analyst here at the CNA Corporation. Today, I'll be briefly speaking with you about a project funded by our organization. And next slide. Every year, CNA accepts research proposals from its staff, and if awarded, CNA are provided a year to execute on that work. Last year, Dr. Lawrence and I submitted for and we received funding to analyze data collected by First Help. First Help is a nonprofit organization that has collected data since 2016 on deaths by suicide in police, corrections, fire, EMS, and telecommunications. First Help and CNA established a partnership in 2023, allowing us to analyze their data on public safety member deaths by suicide. As part of this project, our team documented their data collection method, which includes accepting incidents through a form on their website, the use of Google Alerts, social media, and direct contact with family, friends, and acquaintances of a loved one who has passed. This organization's data collection mechanisms are important as they vary from the FBI's Law Enforcement Suicide Data Collection Initiative, which was enacted by Congress in June of 2020. This initiative requires the FBI to establish a national data collection effort to seek incidental information on suicides, including gestures, ideation, attempted suicides within the law enforcement community. However, initial federal efforts have been slow and encountered challenges receiving agency data. And so while both of these are voluntary efforts, the primary difference between these two data collection mechanisms is the source of information, with the FBI's requiring an agency to submit the data and First Help seeking data through various other means. There are many lessons to be learned from the data that our team analyzed, and I encourage you all to visit the podcast on this slide as well as our additional resources. But before we move to the next slide, I want to emphasize two of our findings here. We found that less than half of those who were known to be experiencing life challenges reported seeking help. Example of these life challenges are mental health, work, addiction, finances, relationships, or medically related. So when we're thinking about the future of this profession, it's critical to understand and address the barriers to help seeking, such as stigma, cultural competency of service providers, and confidentiality concerns. Additionally, firearms were used in 82% of the suicides cataloged here. According to the Educational Fund to Stop Gun Violence, firearms are used in half of all suicide deaths. However, with the access that law enforcement have to firearms, this risk may be increased as we're seeing in the data. Research shows that most people in suicidal crisis who don't have easy access to a lethal suicide method will not simply find another method to kill themselves. Removing access to firearms and other lethal means allows time for both the moment of intense suicidal crisis to pass and for someone to intervene with potentially life-saving mental health support and resources. We still have a ways to go to understand what this is going to look like with law enforcement. Next slide. In line with the overall finding of not seeking help, it's important to note here that while 27% reported a diagnosis of post-traumatic stress disorder, our research indicated that only 17% sought assistance for PTSD. Finally, the last finding from our research that I'll share right now is that we found that when members were struggling with one or more challenges, their risk for suicide increased. This is important to take into context with the research that Dr. Lawrence just presented on, understanding that there are several factors which can influence suicidal ideation, actions, and death. And with that, I'll go ahead and pass over to Dr. Thomas Kristoff. Thank you.
Thank you, Jessica. So my name is Dr. Tom Kristoff, and I'm going to talk today about an article that my colleague and I, Ben Carlton, recently published, where we evaluated buy-in for early intervention systems, or EIS. We can go to the next slide. So the concept of buy-in, it's an important issue, but it's also one that's also empirically overlooked, particularly with respect to EIS. So as quoted in the President's Task Force report on 21st century policing, no program can succeed without buy-in from agency leadership as well as the rank and file. And with respect to this research, we are particularly influenced by Sam Walker's work on EIS, where he discussed the importance of buy-in, but we didn't find any publications that measured how to achieve that buy-in. So that's what we wanted to evaluate, looking at what buy-in was and what influenced buy-in. So in measuring our buy-in, we took concepts that were similar to procedural justice and organizational justice, in the sense that we're really looking to ensure that people believed that it was legitimate and that they were willing to comply with the direction for an intervention, even if they disagreed with it. So we applied this concept to EIS and looked to see how different aspects of EIS, as well as EIS implementation, were related to that buy-in. And we measured this with 3 items. So those 3 items were that the respondent believed that EIS was effective, that the EIS alerts were legitimate, and that they were willing to accept an EIS intervention if they were flagged by the system. So we can go to the next slide. What we had found that was, yes, these elements that we included in our analysis did impact the degree to which officers and supervisors bought into EIS. So we found that respondents who indicated higher levels of familiarity when they bought more into EIS. Additionally, we found that when an EIS was deemed to be wellness oriented, there was more buy-in. And then on the flip side of that, the more that a system was deemed to be discipline oriented, the less buy-in there was. And one of the things that I think we found that was really interesting was the variance in buy-in that we can explain with the model. So in looking at this table on this slide, model A was the demographic questions. And the model A had an R-squared of 0.05, meaning that about 5% of the variance to buy-in was explained by the demographics. However, when we added our items related to familiarity and the perceptions of the orientation of the EIS, the R-square increased to about 0.4, meaning that these constructs they really do play a substantial role in whether or not an officer is going to accept the interventions and view the EIS as legitimate and effective. And we found this to be very important because if an agency is going to have an EIS, the goal is to get officers to accept the interventions. You want the officers to get the help that they need before a potentially career-ending event. So while I think there's a little bit more that we can do to explore the reasons why officers will or won't accept interventions, the initial exploration that we took, we were able to identify some of the core elements that can impact buy-in. And these are things then that agencies, when they're going to sell EIS to members, they really do need to consider when they're developing the EIS and when they're explaining it to the officers, and just overall making sure that the system will be a success going forward. Thank you, and I will pass it back off to Dr. Cunningham.
Thank you, everyone. Thank you so much for sharing the work that we've done over the last couple of years. I want to kind of switch our discussion now, engage all of our panelists into a Q&A, and then following that, I'd like to open it up for any questions you all might have for myself or the panelists as well. I also want to move this panel discussion around the Project on American Justice Futures Framework and the STEEP concepts that you were introduced to by Melissa and Heliana at the top of the last hour. I want to first start with one of the STEEP concepts that relates to officer health and well-being, and that is the social factor. So when I say social factor of the Futures Framework or social factors of STEEP, what I'm talking about is demographics, lifestyles, environments, those type of things. And I'd like to pose to the panelists here today, so Dr. Lawrence, Dr. Christoph, and Ms. Dockstader, when you think about social factors as it relates to the work that you've done or the research that you found, how do you see all of that, or how do you see the social factors such as demographics and lifestyles present in factors related to member well-being?
I'm happy to kick us off with the work focusing on wellness program use and suicidal ideation. There's really three, I would call them, I guess, demographic or social factors that are predominant in the models as significant predictors of both program use and suicidal ideation. One is gender. So women are actually much more likely to use counseling, mental health, and mentorship programs compared to men by fairly large factors. But looking at suicidal ideation, they also had significantly lower levels of suicidal ideation compared to men. But I would note for suicidal ideation that the relationship actually goes away when you include those other characteristics such as their positions, their physical health, and their mental health characteristics when those are included in the model. But it's worth noting that there's also a time order question here. Are women less likely to have suicidal ideation because they're participating in these programs more, or is it the other way around, where because they're participating in these programs more, they have lower suicidal ideation? So that's a future research question. Another area of social factors that are critical here are alcohol use. So there's a lot of literature on law enforcement agencies and staff using alcohol and the impact that it has on their lives as a coping mechanism. So individuals who are moderate drinkers in our research, we found that there's actually an increased level of mental health and physical health wellness program use compared to those who don't drink at all. And individuals who use a lot of alcohol, so the way we define that in our study was 25 drinks or more a month, were more likely to rely on family programs. And those family programs included things like domestic violence education or having family do counseling type of activities. So this really indicates that there are staff who have high alcohol use are perhaps bringing home some of the stress from their job. Among suicidal ideation, when not including the mental health aspects that I mentioned, the mental health and PTSD, when not including those in the model, alcohol consumption was also an important factor in suicidal ideation, most notably for individuals who use 25 drinks or more each month. They had the most severe levels of ideation compared to staff who don't drink anything at all. But again, those mental health characteristics, when they're included in the models, that relationship with alcohol consumption becomes numb. And the last thing I would just briefly mention is relationship status is also an important factor. So staff who are divorced or separated from their partners, they tend to use counseling and physical health programs much more than those who are currently married. And they also, staff who are never married, who don't have a relationship, actually have higher levels of suicidal ideation compared to those who are married. So those are the three social factors that are really critical here. So gender, relationship status, and alcohol consumption.
Thanks, Dan. I will note, Kate, I see your question in the chat. I will get to all of the questions at the end. I have a couple that folks have sent me as well. So we will get to that here shortly. But let me throw the same question over to Tom and Jessica regarding social factors and how you see that present as factors influencing member well-being.
Thanks, Brittany. I'm happy to chime in here. So with the research that we conducted, we did look specifically at the demographic characteristics of decedents to determine whether there was a story to tell. For both men and women, the rate of death by suicide has increased from 2016 to 2022. The data does reveal that the majority of officers who died by suicide were male, with 92%, white, 80%, and in their 40s, around 31%. Previous research has highlighted that white males, the demographic that constitutes the majority of public safety personnel, face the highest risk of suicide. And so when imagining the future of law enforcement well-being, I see a time where wellness programming is crafted with these statistics in mind, understanding what types of programming may be both most beneficial and most utilized by each demographic group. Previous research has also highlighted the risk for suicide for public safety personnel with a military background. But the data that we analyzed from First Help didn't show a disproportionate rate of suicide in the veteran population. First Help data did indicate that 23% of deaths by suicide were associated with officers who had previously served in the military, which is slightly lower than the representation of veterans in law enforcement, which currently resides at about 25%. And just lastly, going back to your the lifestyle aspect of the STEEP within the social factors, research shows that officers are faced with both organizational and operational stressors. However, the organizational stressors are shown to provide a greater strain on the well-being of personnel. So particularly in the light of challenges that both sworn personnel reported to us at work and that sworn and non-sworn personnel are documented experiencing in the workplace, I believe the future of member well-being will rely on agencies intentionally modifying their organizational processes to reduce the strain that they have on their personnel. Thank you.
And I can talk about the social factors in the context of EISs. They're extremely important in evaluating an officer who is flagged by the system. And this comes down to supervision. So typically within an EIS, you have an alert, but then you also have some type of supervisory review. When the supervisor can talk with the officer, when the supervisor can ask how everything's going, again, that's much more of a wellness approach to the EIS, and I think that that's going to be much more successful. I know with some EISs, what happens is you may have 3 uses of force. It creates an alert, and the supervisor primarily looks at those 3 uses of force to see whether there's anything concerning with the actual action. But what they may not do is go and talk with the officer to see, is there something that's leading them to use force more than other officers? And that doesn't mean that there is, it doesn't mean that there isn't, but you really do have to expand beyond just those uses of force. And that's where you can ask them about, is there anything going on at home? But it's a compassionate approach to evaluating the EIS alert. And like I said, what we had found was when you take that compassionate approach, when you take a wellness orientation to EIS, you're much more likely to get that officer to accept the fact that they may need an intervention, and then they can address the underlying problem as opposed to just coming at it from a disciplinary standpoint.
Thanks, Tom. Thanks, Jessica. Thanks, Dan. I'll jump in with just adding what we've seen if we think about command staff and we think about social factors. I think one of the things that I don't know about, I guess I don't want to say common knowledge, but something that we often hear in law enforcement is how much stigma plays a role in seeking support. If you tie this idea of stigma back to leadership theory, which goes back, I think what I'm going to quote here goes back to the 90s with Lipsy's theory on how programs are affected and how program use is successfully implemented. So if you go back to leadership theory and we think about programs and their effectiveness and Lipsy's work, what we see is that there are a lot of what are called exogenous factors and implementation issues. And those extraneous factors include contextual or environmental conditions and organizational factors, which go back to these social factors. So in law enforcement, we can often connect social factors to the organizational environment. And we see that that can affect any type of wellness program and its ultimate success. So tying this back to the command staff and command's own wellness, what a lot of studies, not a lot, I'll say a few studies, and what we're trying to kind of uncover in the work that we do around command staff, what we see is that what we saw in our current study is that program effectiveness not only goes back to law enforcement culture, but also leadership attitudes about those programs. We often also see in law enforcement for command staff themselves, they have that pressure to feel like if they have it all together, their unit will have it all together. And they often do not have programs specifically for them. And when that doesn't happen, when you've got maybe leaders who are hesitant to seek support, that often filters down to your unit, and your unit will be hesitant to seek support. And those are things when you get back to that idea of stigma that the research and practitioners and best practices now are trying to combat. And again, I think that goes hugely in law enforcement into the social factors and touches on many of the aspects some of our panelists have done or have talked about, I'm sorry, and what we've seen in much of our research. I'm going to move on to actually another factor that we see in the STEEP framework, actually two factors. One's technology, so the technology factor, as well as political factors that I think we can see present as it relates to agency member well-being. And I will say collectively, most of the time when all of us here are talking about agency members, we often talk about both sworn and non-sworn or civilian, depending on the terminology you use in your agency. So our work has looked at both. So I should have said that at the beginning, but I meant to say at the beginning and failed to. But I want everyone to recognize that in our center, agency well-being to us means both the sworn, non-sworn / civilian staff in your agency, which is really important. So going back to the STEEP factor framework, so we think about technology advantages. When I say technology, it includes everything from advancements in communication, research, and development. When I say political factors, what we think about in the STEEP framework is organizational shifts, like including more non-sworn / civilian staff. So I'll pose this back to our panelists. When you think about the work that you've done or the literature or research you've seen over the last couple of years and just also your own interactions with law enforcement, I should say that our panelists are very well versed in the research, but also the practice side of how that research and best practices play in the ground and on the field. So I wanted to recognize that about our panelists, because I think y'all's perspective from research and practice and what you see in practice, is really important, and how we marry those. So if we think about technology and political factors, how do you see that influencing member well-being from what you've learned?
So to kick us off again, so a lot of the work that we did, aside from the survey that we collected with 1,200 individuals, we also did interviews and focus groups with a number of individuals, and those were really kind of eye-opening in regards to the program wellness program use and how they are using the wellness programs, how they view staff in the agency using their wellness programs. So one thing I would really highlight here is that communication is obviously key. There are staff who aren't even aware that these programs exist or are available to them. Although in our survey, what we did was I asked staff to ask if how helpful certain specific programs, wellness programs are. And across the board, it was like 95% or more across all the different wellness programs that we listed, and there were 33 of them. They said this is helpful and we need this. So they obviously have a need and a want for these types of wellness programs, but the accessibility to those programs is somewhat lacking because one, they don't know that they're available to them, and two, as you just mentioned, Brittany, that there's a certain stigma associated with them, and that's really critical to getting them involved in these programs. So associated with that stigma, a lot of these agencies have developed wellness programs that are meant to be non-detrimental in any regard to the staff that use them. So they're not going to highlight that, you know, specific staff are using these wellness programs. They're not, some agencies aren't even tracking that information because they don't want staff to feel that this is going to be used against me in any way when, you know, my opportunity for promotion comes up. So that's really critical that staff are aware that this is a program for them to help them, and it's not going to be used against them in any way. In regards to aspects of civilization, I struggled through that. I would mention that civilian staff really feel that the wellness programs are for the sworn staff and the sworn staff only. But we know that civilian staff really do experience traumatic events. Look at dispatchers, call takers. They every single day are dealing with very traumatic events that they have to help manage and work through. So having wellness programs made available to civilian staff is critical. And the study that on our program use utilization found that civilian staff aren't using these programs. Even though they are available to them, they're just geared towards sworn staff. So again, going back to that communication aspect, it's really critical that the civilian staff are made aware that this is not just for sworn staff, it's for everybody. And then the last thing I would mention too is sort of related to stigma, but having command staff, having upper management staff use these programs and speak to these programs and the successes that they've had from these programs is really another way to support other staff using these programs. So we found that upper management staff in our study were the most likely to use wellness programs. I think it was a factor of like 6 to 1 or something like that. So they're really the ones who are using these programs and hopefully emphasizing the benefits that are coming from these programs. Also, crime investigators. So that includes detectives, but it also includes civilian positions of crime scene investigators, the staff that are going through after the scene, after the detectives are there. They're the ones who see some very traumatic things, and they're also using these programs to a higher extent than patrol officers. So I'll note that patrol officers make the majority of an agency, but they're the least likely to use these programs, and there does need to be a way to just make them aware of this program and also, you know, look into opportunities to reduce the stigma around using these programs, because there is a stigma to in law enforcement to using these wellness programs that may not necessarily help the staff in ways that it could be helping them.
So I can speak a little bit in terms of technology's application within EIS. You know, there's two primary ways that I've seen this happen. Is one is the data systems. You know, there's so much data that police departments collect, and having them filter in through a system where it can automate the alert, it can provide all the information to the supervisors. And not only just the alert, but the systems themselves, which can allow supervisors to look at any past comments from other supervisors. They can look at any of the past, you know, uses of force or any complaints, and having a really good data management system at the disposal of the supervisors is super informative for allowing the supervisor to assess the legitimacy of the alert. The other one that we're seeing more recently with EIS are predictive systems. These are still somewhat in their infancy of whether they can reliably identify the officers who are potentially problematic. But one of the things with that is also getting officers to understand what that is, how the algorithm flagged them, what the input variables are. And so I think there's a real opportunity to use predictive systems. I think they're just very unknown right now. And it goes, it kind of goes back to the transparency piece that I was talking about before, is with any new technology, officers want to know how it's going to be used with them and for them. And with the EIS and the predictive approaches that are coming in with some agencies, that I think is where technology is really coming into play. But again, there needs to be a little bit more research in their accuracy, as well as a little bit more transparency within the officers.
Thanks, Tom. And I'll go ahead and chime in here too. So with relation to the technological aspect of STEEP, when we're thinking about communication, I just want to foot stop what Dan said about members not knowing the availability of these programs and that being a key barrier to their use. But there's also another way to look at communication, and it's the communication that agency members have with their in their own agency. So how are they learning about policy changes? How are they learning about training? A lot of what we have, or some of what we've looked at so far, is how internal communications in an agency affect agency member well-being. So whether they are aware of changes, whether they feel that they're in tune with the organization. And so when we saw a lot of procedural changes happening around 2020 with COVID and the protests as well that resulted, a lot of members did not have that. A lot of members had decreased well-being as a result of some of that decreased communication, or feeling frustrated or uncertain about some of their policies and procedures that they needed to be using. And so looking at the way that internal communications affect agency member well-being is certainly an area that I know that we're interested in further analyzing. Another area under the technological aspect of STEEP that Dr. Cunningham mentioned is research and development. And so I would just also foot stomp the fact that we right now don't have an accurate picture, or a fully accurate picture, of what suicide data can tell us across the country. And so as we are able to collect more and more data and understand really what the impact is of the suicidal ideations, thoughts, behaviors in law enforcement, we can then create more targeted programming to help stem those types of behaviors. And so as research and development improves, hopefully we'll be able to create more responsive programming. But also finally, with relation to the political aspect of STEEP, I definitely do think of civilianization, and I think about some of the research that we've seen highlighting the dysfunctional communication that we've seen between sworn and non-sworn personnel. So not only are civilian or professional staff feeling like the programming is not targeted or responsive to them, but they're also feeling othered in the workplace. And so if we're thinking about a future of civilianization, particularly in light of the recruitment and retention crisis that law enforcement has been facing over the past several years, we need to make sure that civilian staff are coming into an organization that is welcoming of them, that's embracing them. Otherwise, we're going to experience that same recruitment and retention process with the civilians, just as we've seen with sworn staff. That's all. Thank you, Dr. Cunningham.
Thanks, everyone. I want to kind of wrap up just kind of like our panelist piece. And then we do have several questions that I see in the chat, so I'll pose those to everybody. And then please, if anybody else has questions or comments, please start putting those in the chat. We have almost 30 minutes left for our session, so we want to make sure we can answer all the questions and have a discussion at this point. But there are a couple terms that I heard many of the panelists say today, or concepts that I heard everybody say, and let me just kind of walk through those on things that seem needed. So if we think about future and kind of where do we go with this idea of, or how do we support and again, foster agency, both sworn and non-sworn / civilian staff well-being, what do we need? How do we need to better support agencies from research and field practice? Our field research as well. And the first was communication, the internal communication among agencies on it is okay not to be okay and to seek services and how to do that. But also external communication, not only within your own agency, but a broader message on We know there's a stigma, but how do we really get rid of this? Because it's still pretty huge in what we've seen in our research, and we saw it among all types of agencies. One of the things we didn't really get into everybody we've worked at, but we've worked with sheriff's offices, municipalities, tribal organizations, small rural agencies. So we have seen this idea of internal communication needs to be improved, even just communication on how do you access your own services. And that came out when we did the workshop, particularly when we piloted the workshop I talked about. That was one of the things that often came out, like agency members don't know how to access something, or they think their name's going to be shared, or they don't even, they don't know you can pay for cash to go see this or that, right? So just internal communications, but then again, getting these best practices at a holistic level or an external level, communicate those and get those out there more. The next one was awareness of programs. A lot of times, folks at the agency level or even the command staff aren't very sure of all the programs that exist. And again, that goes back to communication and how to use those. Education. I think education and educating everybody across law enforcement, whether that is identifying when someone's in distress, or also identifying what program best meets their needs. It's not a one size fits all that we have found across the research that we've done. And also education to families, I think, is really important. I know we didn't touch too much on that, but this idea of education around what can go on with an agency member, how that affects only your family, and also the resiliency piece is something we didn't get to touch on today, but it's a huge piece of what we've seen that's kind of underlying in the work. Responsiveness. So responsiveness from the field on what's needed, responsiveness from executive staff, and the inclusion, I think, of all agency members is really important. And Jessica touched on it. So that's something else that came up. So responsiveness, inclusion, and flexibility. I think that what we've seen, and Dan, you brought this up, this idea of maybe a service weapon being taken away, like there's no flexibility, but there may be, but people don't understand that flexibility when something happens or you've got those suicidal ideations. But I think flexibility in what works for your agency. You can't necessarily take someone else's program and just drop it in your own agency, like a peer support program, which are great, but you can't necessarily take someone else's model. You've got to be flexible enough to know you need your own model or take pieces of this and that. So again, communication, awareness, education, inclusion, responsiveness, and flexibility were the 6 words that I kind of wrote down as our panelists were talking. So again, thank you to our panelists. I'm going to move over to, we've got, I think, 4 or 5 questions I see in the chat. So I will start posing those. And then if more questions pop up, I'm going to actually, right now I only see the panelists. So I'm going to change my view really quick so I can see in case somebody raises their hand. So feel free to raise your hand, put things in the chat. But the first question that I'm going to shoot over to Dan, and Dan, this was specifically about the research that you did around suicide ideation. Can you talk a little bit about how you measured suicide ideation in your work?
Sure thing. So there's a lot of different ways to measure suicide ideation, and I would also point to there's a lot of behaviors associated with suicide ideation that can be used to allude to different ideation metrics. So for our study, it was based on a severity scale. So being as such, I mean, I won't get into the statistical analyses, but we used an ordered probit model because it's a scale that as you grow in the value, it becomes more severe. So I mentioned it during my discussion, but there is this, it's based off of, having no ideation at all. So that was the majority of the sample, 75%. And then having contemplated suicide. So this is something that actually comes up fairly often for everyone. Like, oh, what if I jumped in front of this train? Just thinking about it. That's a little bit that can. Some people may say yes, I've contemplated suicide in that way, but it's a little bit more involved in that. So actually, thinking about it in more detail and in reoccurring detail. The other metric that we looked at was actually setting out a plan. So that's a very severe metric. So having a plan where you would actually go through and say, today's going to be the day. That's a very severe metric that we included as our final category. And then of course having a pass attempt as well. So that's, obviously the most severe. But as I noted, there are very limited individuals who end up having those types of more severe metrics, but we defined it as this, rolling scale of getting more and more severe behaviors and ideations around suicide in the analysis that we conducted.
Thanks, Dan. Dan, while you're on the spot right now, I want to go back to Kate's question that was around, so it says, is there an idea for why the link exists between the moderate drinking and the wellness program adoption, which was kind of one of the slides you showed?
Yeah, so it came to that moderate drinking, so not the most severe drinking and not the least amount of alcohol consumption. They actually were most likely to use specific types of wellness programs compared to non-drinkers. So that is an interesting thing. I don't know the literature on this area, but one thing I would allude to is that the second wellness group that we identified, so those individuals that were most normal, and emphasizing the quotes here, those individuals that were in the middle, they were most likely individuals who were consuming some amount of alcohol. So they were the individuals who were using the wellness programs to the highest degree as well. So there's probably a high overlap between some alcohol consumption and being, quote unquote, normal, having very, stable psychological and physical health metrics. So that's what I think is probably explaining some of this, is that the largest grouping, the middle grouping are also the ones using the programs the most, and that's what's resulting in that moderate level of alcohol consumption using programs the most.
Thanks, Dan. I'm going to go to Allie's question in the chat, and I think Jessica might be able to chime in here, so I'm going to put Jessica on the spot. The question reads, is there any research on changing application processes for incoming law enforcement officers? And then there's a follow-up question to that. So Jessica, what do you think?
Thanks, Brittany. So Allie, this is a great question. And so I don't have a perfect answer for you about the research on changing the application processes for incoming law enforcement, but I do have a couple things to touch on that get to your question. So one of the things that we look at, officers do go through psychological screenings when they enter the law enforcement field. And one of the things that we looked at, and specifically we looked at as part of our project through the Bureau of Justice Assistance, was whether or not the folks who are the clinicians and who are conducting some of those psychological evaluations are also conducting what we call like a fitness for duty process. And those should never be the same. So someone should never feel that the person who's evaluating their ability to do their job is also the person who they're going to go to when they are seeking mental health services. And so that's one of the ways that we kind of sequester helping folks to feel that they can seek help and hopefully that it won't be used against them for their job. Another thing that I also wanted to talk about was you put in here, how can officers feel that there's no stigma associated with mental health when they were hired on the basis of mental health in the beginning? And so I also wanted to kind of throw this question to Dan a little bit, not this specific question, but it's very interesting when we're looking at the suicide data. It gets a little tricky because there's something that the research calls the healthy worker effect. Can we actually be looking at, and how do we compare the statistics of law enforcement who are supposed to be, by all standards, a healthy group as they're coming into the profession? And so then how do we compare them? Is the problem actually worse if they're experiencing suicidal ideation, thoughts, and behaviors because they were shown to be a healthy individual when they entered the job? And so, Dan, I didn't know if you wanted to talk about what, kind of what you're exploring and what you found in relation to kind of the healthy worker effect and how kind of the struggles we've been going through with evaluating that suicide data.
Sure. So I would actually, I was thinking to myself when Allie first asked that question, back to my dissertation, which actually focused on the screening of officers at the time that they applied to police departments. And I agree that there's a lot of focus on what's referred to as screening out. So identifying the individuals with severe depression or identifying individuals with schizophrenia, making sure that they're not going to continue through the application and recruitment process and training academy. But there has been a shift in more recent years actually this was about a decade ago at this point, but looking at screening in applicants. So identifying officers who are going to be strengths to the police department, identify officers who are going, or individuals who are going to be using those procedural justice behaviors, or who are really strong communicators and can, you know, de-escalate situations when they need to. And then weighing that against those aspects of, you know, okay, they are flagging for depression. Let's talk to them about that and see if that we can alleviate those aspects, because they're also showing for being, you know, a strong police officer with their social skills. So there is like a balancing that needs to occur. In more recent years, there has been this, you know, recruitment and retention crisis in policing. So there has been sort of like an opening of the door for a lot of agencies that they're trying to get as many people involved as possible. And they've less use those aspects of, you know, let's flag the psychological issues, let's flag, you know, the strong officers, psychologically speaking, for like procedural justice and things I was just mentioning. So in that regard, I would say there is this, you know, at the application stage, at the screening stage, I would say things have shifted a bit to be a little bit broader and getting officers, individuals into the field, and then identifying those issues later on and getting them the help that they need so that they can stay in law enforcement.
Thanks, Dan. Thanks, Jessica. I'll throw one comment in here that's not technically, I guess, related to what Allie's question is, but I think I think wellness and those conversations and education around wellness start early. One of the things that we have not gotten a lot to in our research, but we will, so if there's NIJ or BJA on the call, we're going to come for you soon, is the idea of well-being in field officer training. It's a really important step. And I think that if we can make that awareness and talk about that stigma openly as soon as we can with officers, it could improve. And to have those open conversations and be okay having those open conversations during field officer training can be really important and kind of start that trajectory on being well, those type of things. So I'll just throw that in there, but I know we have a couple of other questions here, so I'm going to get to those. I'm going to throw a question to Tom that someone just put in the chat, and that is, Tom, are there examples of agencies doing EIS well? If so, what makes those work?
It's a difficult question. I guess it really depends on how you're measuring what doing EIS well means. You know, I know that if we're talking about reducing force, if we're talking about reducing complaints, which I think is what a lot of EISs do, there's a lot of EISs that can do that simply through depolicing. And, you know, a lot of times that's just how EISs get evaluated. I think in terms of measuring whether they're doing well, we're still scratching the surface of what that means. One of the things that we're doing right now is we're doing an assessment of about 70 different policies across the country. And what we're seeing is that there's no really single thing that can be considered EIS. They differ across identification, selection, intervention, supervisory roles, as well as their overall tone and approach. You know, like I said, there's some that are very disciplinary, there's some that are wellness. One of the things that really can push that wellness piece is just being aware of where the EIS is housed. A lot of them are housed within IA. I can talk about elements of different agency policies. And I think that that's really where we need to focus on breaking that out and identifying where which element should be considered a best practice. Kind of the research that we've done, that wellness piece, it should focus on wellness. And that's why I'm saying that them being housed in IA may not reinforce that concept of wellness. But they also need to include other elements of procedural justice. One of them being the concept of voice. So what we're seeing in some policies that we're looking at is sometimes officers do have a say in the intervention, sometimes they don't. So for instance, think it was Baltimore County PD's EIS. The officer and the supervisor jointly develop the intervention together. And that goes kind of, to that concept of voice that also, goes into the concept of buy-in that I spoke in with during the presentation. Because if the officer is developing it together, they're more likely to buy it. I think with the idea of familiarity, which we found to be significantly related to buy-in, it's the New Jersey State Police. They include the EIS forms as an appendix to their policy. So it's very clear, it's very transparent as to what will be collected during that initial review, what's going to be documented at the conclusion of the review. So like I said, there's elements of EIS that theoretically are going to be, better or worse than others. But that's where I think the state of EIS research really is going, is breaking it out more so that when an agency is looking to implement an EIS, you can look around at those different policies and see what best fits your agency and what you're looking to accomplish with the EIS.
And I just want to add quickly too, I think EISs, and I think a lot of people know this, they're shifting from this disciplinary factor to identifying individuals who are in need of wellness programs. And so a lot of the research I previously mentioned, specifically to suicidal ideation, we found that PTSD is a critical component to individuals who have higher suicidal ideational levels. So I could see EIS being used as a system to flag officers who have experienced those very traumatic events that officers commonly have to deal with. So flagging instances where there are a higher likelihood of PTSD developing and being assigned to an officer would be a good way to get those officers in front of somebody who can then say, hey, I know you've gone through this event. We have these resources in place and we'd like you to pursue these wellness resources because we're worried about you. So that's a system that currently exists that could be used to flag officers to get them into these wellness programs and make them healthier individuals.
If I could just add on a little bit to that too, and Dan, you're absolutely right. And this is where that predictive element of EIS is moving towards. And one of the things that, when I talk to the police departments about EISs, EIS is a concept. You are attempting to identify an individual who could benefit from an intervention. Now, whether that be related to use of force, whether that be related to complaints, is historically what EISs did, that's just how they've applied that concept. And I think to Dan's point, if you apply the concept of being able to identify the person who may have suicidal ideation, or who has, it can be really used for any number of things. And so I would say, continuing as to what makes EIS a good EIS, it is an EIS that addresses the issue that the agency is interested in. And once you can address that issue, or once you can identify the officers who are more susceptible to that issue, and you're getting them the interventions and you're seeing improvement, then it would be a success. But yeah, that's I think to Dan's point, that's really where the predictive pieces are going in. We just really need officers to understand why they've been identified and what it means and what it doesn't mean.
Thanks, Dan. Thanks, Tom. I'm going to go rogue here a minute and put some of our participants and audience members here on the spot. I just saw Dave's face, like, please don't call on me, but I'm not going to call on anybody. But we've talked a lot at you, and we've talked to you about command staff, the role of supervisor. We've talked about EIS. We've talked about the utilization of wellness programs and suicide ideation. But I'd like to throw it back out to all of you who are sitting in agencies and also some of our federal partners. What is your reaction, or what are your comments on this? What do you think? What do you see works, or just general comments? So I'm going to have our panelists. I see someone here, Eric, thinks you just put a comment in the chat, but others, what do you think? What about what you're hearing?
Brittany. Hi, this is Sarah
Sarah.
Jama. Hello. I work with the Bureau of Justice Assistance and I support the Valor Initiative, which is focused on officer safety and wellness. And I think, throughout all of it, suicide based or just wellness in general is the culture. It really needs to be a culture change throughout the entire organization. And understanding that wellness is a part of safety, much like physical safety. So if you're going to wear your body armor, you also need to be aware of your mental and emotional and psychological safety as well. And I think the term stigma was used a lot, and unfortunately, that's a huge barrier for people seeking both wellness support and especially when it gets to the suicidal ideation. And so really trying to remove that stigma, talking about things, making normalizing. I hate the saying it's okay to be okay. It's okay to not be okay,
Yeah.
but it's true. Just normalizing that, hey, we all have struggles and, we're here and we are here to support you. So, the two different things are, trying to remove the stigma and a culture of wellness.
Thanks, Sarah. I think that's really important. And Dave, go ahead. David Mahoney.
Thanks, Brittany. I want to follow up on Sarah's comment. And I think it starts with executives and the command staff. In my agency, there was a lot of discussion of yearly check-ins, mental health check-ins through an outside practitioner. And I think it was important for me to identify that I was going first and reiterating that there'd be no stigma for participating. Matter of fact, it was mandatory. Everybody, including the sheriff, had to participate in this, and that it was a culture of changing the character of the organization and making us all healthy. Because our goal is to ensure that after you leave, after a 40-year career, you're as healthy as you were when you came in.
Thanks, Dave. Anyone else? Comments, questions about what you've heard?
I'd just like to ask Mr. Mahoney a follow-up question.
Sure.
Thank you so much. It's so important to lead by example, and I completely agree with you. And I've seen and heard wonderful things from annual wellness check-ins or however often those are. I just wanted to ask you about any barriers you might have received in implementing those. Sometimes we hear that some unions aren't in favor of those. I don't know if you're a union state, so could you just talk to us a little bit about that?
Well, Wisconsin is a union state, and largest stigma to overcome was this perceived stigma that anything negative, if you consider that, will be used against that individual further in their career. And it was just a message that had to continue to be delivered, that this was about making our people healthy. The job that we did, the job that we do, the things that we're going to experience and see over our career will have an impact on us, and that the goal is to make us healthier. But there just seems to be this overriding stigma that, I heard so-and-so was impacted when they came forth and asked for help. Many times it was a hypothetical that never happened, but it is something that I faced on a regular basis. And it was just having to reiterate the importance. The union actually was very supportive. In our peer support program, we have dedicated staff for peer support, and then we have an outside agency that provides our in-house mental health and check-ins.
Thank you so much.
Yeah, others. I know there's some other local agencies on the call and some other federal partners, but also our colleagues. Other comments or questions, or what worked, what hasn't worked as well.
Good morning. Thank you, everybody, for your time. This is Andrew Nollmeyer from Phoenix PD. You guys are talking about stigmas, and one thing that we found is people are having issues actually sharing the information. So if we reach out to a supervisor to have the conversation and that gets documented, people are very concerned about that. So one thing that we're doing that we just started is to work on some legislation where at the state level, we can actually protect that information from public records requests. So we'll see how that works out. We're in that process now, but I think that that's going to be a huge benefit, not just for our agency, but anyone in the state. I know that Kentucky has already done that too, if anyone's interested in looking up the bills, but I think that's going to be a big win for us once we get that approved.
Yeah, one thing I mentioned previously is that one of the agencies that we spoke to about their wellness program use, they collect no data on who's using the program whatsoever. And their whole reason for that was that they didn't want it to be used in any disciplinary records. And they felt that that was also a strength to the program, to people using the program, is because they knew that there was no records of who was using the program, when, what specific wellness program, so on and so forth. So the agency itself felt that it was a strength to have that be a very anonymous process. As a researcher, I hated it, but I also understand like the reason why it's critical to, especially in this domain.
Anyone else? Feel free to come off mute. We love to hear from you all, what you're seeing in the field and your experiences. Dave, you came off mute again. Go ahead.
Yep. To follow up on, I think it was Phil from Phoenix. If he wants to reach out to me or Research Wisconsin Law, with our state supported line of duty death, as long as our peer support specialists have been trained, they are considered privileged in having conversations with fellow staff, and it's worked very well and developed a great deal of credibility as we move forward in our agencies.
Thanks, Dave. I'll throw out one other, or Andrew, I saw you come off mute. Go ahead.
Yeah, I was gonna follow up on that. So we also have that. It's critical incident stress management. So we have something that protects those conversations. Just for everyone's knowledge, one thing that we ran into though is it doesn't specifically protect public records requests, and so it runs into an issue of how is that law going to be interpreted. And so we really want to just kind of button it up to say, hey, like these documents, these referral forms that we're going to send out to supervisors to document the conversations, we really need something that very specifically protects that. So that's why we're going to go down this route. But yeah, the CISM protections have been huge for us too. We actually work as part of our employee assistance unit now. And so we work in tandem with them. We actually shifted over from our internal affairs. So that was a huge move for us, just for the buy-in and everything, but also it kind of gives us direct access to wellness. So this is just a perfect talk for us and kind of what we're going through. So I really appreciate everybody's time.
Thanks, Andrew. I'll throw out one more question actually to you all here that are on the in the session with us today. We've talked a lot about well-being and wellness, but some of the things that we've seen in our research, not only in law enforcement, but also on some work we do with the armed services, is the connection between health, so physical health and well-being. Are there things that you're doing at your agency, if you think about more of the health or physical health side, that have made a difference in the wellness side of your officers or correctional deputies or prosecutors? I saw we've got NDA on the call too. So feel free to jump in. What are you doing on that side, or what's worked?
I'll jump in again just to kind of get the ball rolling. So in Phoenix, we're actually lucky in that our EAU, our employee assistance unit, has quite a bit of resources. And so we hired a company called O2X to come in, and they've actually plugged in two separate individuals. One person their entire job is to help with injuries, either on the job injuries or just pre-existing injuries, and kind of how to work through those and come up with plans to assist with that. And then we have another person from O2X who's come in to be specifically like a nutritionist, and they can create workout plans. And they've actually set up, and so they can either have like remote out to satellites at our different precincts or at our headquarters. We actually have a gym set up where they can walk people through everything. And they've just started within the last year, but we've gotten a lot of really good feedback from that so far.
Thanks. Anyone else want to chime in before we close out? What are you doing around health or other wellness programs that you think worked? Or did you do something that didn't work that you would advise an agency not to do, another agency not to do? Okay, well, we are right at time. Again, I want to thank our amazing panelists and researchers that spoke about the work that we're doing in our center and able to share that. And I really appreciate you guys letting me put you in the audience here on the spot, you're our audience. You're the ones that we want to find research to support and come to the field and see what's out there. If you have any questions about the work or that I talked about, our panelists talked about today, you can email us. We're always happy. And like I said, we all love to talk about officer health and wellness. So reach out to us and let us know. And I think, Heliana, am I turning it back over to you? So again, thank you all.
Yes, thank you, Brittany. And a big thank you to all of our panelists and attendees. So please join us for our next session, a keynote message from Lou Leary, CNA Board of Trustees and former Deputy Director for the Office of National Drug Control Policy at 3 p.m. Eastern. So please join us at the main Zoom link anytime over this next upcoming 15-minute break. Thank you again.